Tanya Kitzlewinski, special education teacher and president of the Kenosha Education Association. Last spring, this board voted to replace our long-standing health insurance contract with We Trust with a high deductible plan under UnitedHealthCare. The decision was an attempt to resolve a budget deficit by shifting costs from the district to the district's educators, and it did just that. But the biggest hit to educators came with the timing of the contract, that after just 6 months, our yearly deductible and out-of-pocket maximum would reset at zero. For educators, that meant that a family with any significant healthcare needs would be forced to pay a $3,000 deductible twice and could be responsible for up to $12,000 in healthcare expenses in just 18 months. This quarter, KEA surveyed KUSD educators regarding the impact of our new healthcare plan and received 528 responses. I'll begin by highlighting some of the most significant findings. Over 90% of survey participants are dissatisfied with deductibles and out-of-pocket costs under UHC. And based on that, just 14% of participants stated they are likely to seek medical care for mild to moderate health concerns. Here are just a few of the examples given by educators of times they have skipped or delayed medical care this year due to cost. Pain and running a fever of 101.2 for 2 weeks, finally went to the ER and was admitted. Put off going to doctor with sore throat, eventually went when I had a bad fever, turned out atypical influenza that led to pneumonia, caused me to miss 4 days of work. I was in a car accident. ER wanted me to stay in for observation. I was told my insurance may not cover that, and I left the hospital and went home that night. I'm putting off a skin biopsy this year. We've delayed going to the doctor for suspected strep and only go if it's near emergency now. My husband didn't go to the doctor because we weren't sure if he had an infection, then needed an MRI and multiple doses of an antibiotic to treat his infection. In addition, 47% of participants reported they have rationed or delayed refilling prescriptions. Here are a few of their responses when asked, what have you rationed or delayed? I can't afford my mental health prescription, so I go against medical advice and take it once every 3 days so it lasts longer. I only use one of my inhalers once a day instead of the prescribed twice a day. I now take my arthritis medicine every other day, even though it's a daily dose. My wife and I had to determine which medications would be best for use and stop taking the others. I have also stopped checking my blood sugar levels because the Lancers are not covered by insurance. Again, I have to choose to put food on my table or medical supplies. I choose food. I quit taking 3 of my depression medications and stopped my fertility treatments because they were not covered and I could not afford the out-of-pocket costs.
Kathy Andrusiak-Montemuro, third grade teacher and KEA vice president. Not only is the current health insurance plan affecting educators' overall health, it's eating away at their time. 24% of survey respondents have spent 4 or more hours weekly dealing with health insurance-related issues. That is valuable time that could be used grading papers, creating lesson plans, and meeting the needs of our students. The real question is, how can we do what's best for the students of this district without healthy, present educators? This board has a decision to make regarding how to spend $7 million. In the days of austerity budgets for public school districts, it's a rare dilemma that with many competing interests. However, budgets are moral documents that reflect what we value. And this surplus was realized largely on the backs of your educators. Our educators have remained committed to Kenosha Public Schools. We love our students. We have stayed through the erosion of our voice, our time, and our livelihoods. Will you show us that we are valued? To help alleviate the burden being experienced by many Kenosha educators, we are requesting that the following be included in a classroom and financial recovery package. First of all, a student resource stipend. The average teacher spends several $100s of their own money to provide much-needed supplies and learning experiences for their students, a cost many Kenosha educators can no longer afford. A student resource stipend equitably allocated to each school would aid in the purchase of basic school supplies, funding for field trips, and incentives to help reinforce positive and respectful behavior. As the people that know best what students need, it is essential that educators have complete authority in deciding what is purchased. A general stipend for employees. It is fundamentally unfair to charge a yearly deductible and out-of-pocket maximum for only 6 months of coverage. For some teachers, this means that they will end up paying nearly $12,000 out of pocket in just 18 months. For a full-time teacher at the lower end of the pay scale, this could result in nearly 28% of their income before taxes. For a full-time ESP, it is nearly 38% of their income. Money that was saved on the backs of educators should be returned to them so they can receive the wellness care they need to be effective in the classroom. And third, a courtesy credit. Many KUSD educators have spouses that are also educators in the district. It is a common practice in other districts to provide a one-time stipend payment for spouses both employed by the same district in consideration of the realized savings. That same stipend is often afforded to educators that opted out of the district's offer of health insurance coverage. The district savings are a direct result of educators that opted out of the plan. It is only fair that a portion of that money be returned. Board President Wade has stated that health care is not a right. It's a privilege. Our students have the right to a great public education, and they need high-quality educators who are healthy and present to make that happen. This surplus should be directed to that end.
I'm a library media teacher in my 29th year teaching in KUSD. I am here tonight to request the board considers a monetary stipend and 2 additional sick days for all employees to help relieve the burdens as a result of the change to UnitedHealthCare. I would like to share with you my story to help you understand the types of burdens that have been placed on educators and how it is affecting my teaching and my students. I was diagnosed with a chronic medical condition 14 years ago and currently receive medication delivered by infusion every 6 weeks. My health has improved significantly since receiving this treatment, and I was grateful that WA Trust worked with my doctor to cover and coordinate the care I needed. I was very concerned when the district voted to change providers, so I attended meetings and spoke with UHC representatives regarding my specific needs. The rep reassured me that my doctor and infusion center were both in network. They determined that I met the requirements and would be able to continue my current treatment plan, so I enrolled my family with UHC. July 1st arrived. I was informed that United does not cover infusions at medical facilities, and I would be forced to receive my infusions at home. My home is not set up as a sterile medical facility. No one ever mentioned this while I was considering insurance options. I felt it was a classic case of bait and switch. I have some of the medical supplies and waste I now have to inventory and store at my home, including emergency meds for an allergic reaction. Would you want to be in a medical facility or at home during an adverse reaction? My other responsibilities also include, but are not limited to, coordinating FedEx shipments with perishable medicine, scheduling shipments of medical supplies, and ordering my lab in a box for blood work, discussing medication with pharmacists in another state, making spreadsheets to fix billing errors, rescheduling home nurse appointments because my lab in a box did not arrive on time, making phone calls to track down lab results, only to discover that blood was not tested due to the age of the sample because it needed to be shipped to a lab in Kansas for testing. The list goes on. I miss the days when I could spend my time focusing on student needs rather than spending hours managing my health. I used to spend lunch leading book discussions, but now I spend time calling nurses. My evenings were spent working on school committees, writing curriculum, attending student programs, reading professional journals, updating the school website, and creating parent newsletters. Now I spend my time waiting on hold for hours with the insurance company. The cherry on top of all of this is that I have incurred almost $14,000 in out-of-pocket costs in only 7 months. Despite now having to do the work of a doctor or nurse, I don't get paid like one. This has been devastating for my health. I'm supposed to be an educator, not a medical professional. My only job should be taking care of my students and providing them with the time and attention they need to excel. Again, I'm asking board members to consider easing the burdens by voting for a stipend and 2 additional sick days. If not for the sake of your educators, then for the sake of our students. It is impossible to explain my full story in 3 minutes.
I'm sorry, but your time is up.
Please contact me if you would like to hear additional information. Thank you.
Hi, my name is Delina Ryder, and I've been teaching here for 24 years. I will have to say that this is the first year I've ever been embarrassed to explain to colleagues and friends of mine outside of this district the insurance that we have. They work out in the Kenosha County area, and their insurance is much better than ours. With the change in this health care this year, the large deductions have really impacted my family. After the first 6 months of insurance, I really hesitate to go to a doctor now because I owe $3,000 from July to December, and now in January I already owe $2,900 for expenses. With my 3 sons and my husband, I should be seeking medical care for myself, but I find myself putting it off. When in the past, a simple $10 copay was easy just to walk into a doctor's office. You have your diagnosis, you get your medication, you're at home, $10 later. The low salary increase and the lack of increases over the past few years has really felt like a slap in the face to educators. Our low salary was put on hold because of our insurance before, and now the insurance that we had from WIA is gone. We as educators do not make the money that we should. We dedicate countless hours to our students because we care about them. We treat them like they're our own, and we want them to be successful in everything they do. It is shameful that our Kenosha Unified School Board devalues teachers and expects us to pay high deductibles, taking away from what little bit we make.
Hello, I'm a third-year teacher in KUSD, but I've worked various positions within the district for the past 12 years. I love this job, my students, and giving my all to impact the community and classroom in positive ways. Anyone close to me knows that I truly spend the majority of my free time, energy, and funds making plans to better the learning experiences for my students. With the recent change to our healthcare plan, a lot of those extra resources that I used to give to my classroom are now spent juggling my healthcare needs. I'm now spending at least 4 hours a week dealing with medical and insurance-related issues instead of spending my time on my students' education. To get the best price on reoccurring prescriptions, I currently have to go back and forth between 2 different pharmacies. For one of my regular monthly prescriptions, I am now only allowed to pick up 2 pills every 4 days. The extra time this soaks up has taken a toll on my ability to offer the after-school communication and support to my students at the level that I want and have had done in the past. As a teacher on the lower end of the pay scale, the impact of this insurance change has been financially overwhelming as well. In 2019, my family met our full deductible under WIA Trust prior to the switch. After the change to UHC on July 1st, I originally did my best to hold my family from going to the doctor unless it was for an emergency. Unfortunately, that emergency came when I myself became too ill to put off going to the doctor any longer. While in the ER and the next day at the doctor's office, I had to pause on all medical tests and blood work to see which labs I could afford to do, and that would be the least expensive under the plan. Unfortunately, the least expensive place to get these labs done and have some answers for my immediate pain required me to leave the hospital and not get those results to my doctor that same day. When the results finally did come back, I found out that surgery would be my only option. I asked the doctor if this surgery could wait until summer for the sake of my deductible and not wanting to be away from my students. I was told that my situation would rapidly worsen within days and that he was already in disbelief that I had put off coming in for so long at this point. With that surgery on December 1st, in December, I met my full $6,000 out-of-pocket right at the end of the first 6 months with UHC and ended up needing to take days off of work to recover. Had I felt comfortable going to the doctor sooner and not so preoccupied with these costs, my situation may not have gotten to that point. As a result of the surgery, I am now in need of a new medication that costs me just under $1,000 a month. That is $1,000 in out-of-pocket costs to hand over to the pharmacy every month with no payment plan available right as this new deductible turns over. With this medication and the follow-up appointments for my surgery, I'll be meeting the $6,000 out-of-pocket again within just the first few months of 2020. Again, I love serving and impacting my community and my school and my students. I thank you all for listening and taking the time to hear my concerns and how this healthcare has affected me and my family and my students. Thank you.
Hello, my name is Samantha White. As a young and single educator on the low end of the pay scale, I would like to share with you how the recent insurance plan switch has greatly impacted my life in the last few months. In the first half of 2019, I met my $750 deductible under WIA Trust and reached about $1,200 towards my out-of-pocket maximum by the end of June. For reference, that means in the first 6 months of 2019, I had already paid the equivalent of more than one paycheck towards out-of-pocket medical expenses. By the end of 2019, I had met my $1,500 deductible under UHC and came to a total of about $2,200 towards my out-of-pocket maximum. Again, for reference, that is 2 entire paychecks or 1 full month of pay towards out-of-pocket medical expenses only in the 2019 calendar year. As we entered the new year, I am sad to say that one of my goals for 2020 was to not go to the doctor and to cut back on a few of my prescriptions. After having spent so much out of pocket in 2019 because of the change in plans, spending more on medical concerns was simply not an option for me. In theory, this would have given me time to rebuild my sadly depleted HSA. In reality, I severely injured my back on January 7th and found myself with a whole new set of not only medical concerns but financial ones as well. Between an emergency room visit, x-rays, an MRI, and several visits to specialists, the week that followed resulted in approximately $4,000 in claims posted to my account. While many of these claims are still listed as in process, it is already reflected that I have already exceeded my deductible yet again. It is difficult to describe just how financially devastating it is to have already paid an entire new high deductible for only 6 months of coverage under the new plan and to be expected to do the same again so quickly now. I currently already work 2 part-time jobs in addition to my full-time teaching positions in order to pay my bills. My stress levels have increased exponentially over the last few weeks as I have been scrambling to pick up additional hours to pay for the incoming bills. When coupled with the amount of time that I've had to spend calling hospitals, service providers, and UHC, in addition to frequently checking the status of my claims and reporting errors as they are found, I have not been able to devote as much time and attention as I typically would outside of the school day to preparing instructional materials and behavioral supports for the diverse population of students with whom I work. I am now losing hours a week trying to manage these situations to the detriment of my students and myself. Because a significant portion of the surplus realized by KUSD was born of the burden on the back of educators like myself, I believe it is truly crucial that a portion of these funds be returned to educators enrolled in this new high-deductible plan in the form of a one-time stipend. I am asking board members to mitigate damages done by this plan and to help educators overcome the financial burdens monopolizing much of our time and energy so that we can focus on giving our students the education that they deserve.
Tonight I'd like to spend my time on behalf of a colleague who's chosen to remain anonymous. They grew up as a child of educators and grew up with the trust. He can't recall his parents talking about health care or how they would pay for it or the care that their siblings and he would receive. They were just simply never concerned about it. Skipping ahead to Act 10, teachers helped rescue the district, their finances through the acceptance of more modest compensation in exchange for continuation of those benefits. So he as an employee was able to purchase the WIA trust for his family. We would have liked to have more significant compensation, but felt fortunate they wouldn't have to sweat a sudden influx of medical bills resulting from unforeseen circumstances. July 2019, his family's luck changes, just as our insurance does. WIA is dropped for UHC, which ushers in a 500% increase in family plan deductibles. Within a week, his wife experiences significant medical problems, causing him to exhaust what little HSA he'd been able to accumulate, and the remaining balance of his deductible is now due. Subsequent follow-up procedures proved costly and not covered to the extent they were under WIA, and he continues to pay toward out-of-pocket max limits and coinsurance costs. I recall his relief that they had satisfied their deductible and nearly reached the limits for the year, and then I recall having to tell him that it would reset again on January 1st, and recall watching the color drain from his face. January 2020, he's still paying last year's medical bills when his teenage son wakes up one night in early January, the first week back from break. They make a trip to the emergency room and discover that it's kidney stones. They have now met the family's 12-month deductible in full for the second time in 6 months. As we know, he'll continue to pay out of pocket till he reaches $6,000 and exceed that with coinsurance. And these expenses likely approach 5 figures. This is money he would have been able to spend on the braces his daughter soon needed afterwards, or help pay those holiday bills that many of us incur at the end of every year. This is most certainly a string of bad luck, but it is hard to argue that these stretches are uncommon among many American families. These bills will likely remain well into 2020 or be paid from personal savings accounts as they occurred before he was able to stockpile money into the HSA. There wasn't time for that. We now enjoy a one-time budget surplus of nearly $7 million, and this windfall is again due in large part to the sacrifices of KUSD's employees. This time around, however, we can't rest easier knowing our insurance justifies the collective sacrifice. In the past, the district has shown a willingness to issue stipends to employees for various reasons, and I see helping families like this as good a reason as any. This gesture of good faith would be appreciated by those like my colleague who could really just use a break.
Thank you, Luke.